And we focus in understanding how does the immune system work in different diseases. So we target from the brain, the heart, the lungs to the joints, also the muscles. All the different organs of the body are affected by the functioning of the immune system. So we teach the students how the immune system works and how can cause disease. And also we teach the students how you can modify or engineer the immune system in our benefit. So how we can develop therapies using antibodies to target tumors.
So every week we cover a different subtopic of the immune system. So 1 week's about immunity to cancer, 1 week's about autoimmunity or immunity against viruses, or how you can use your microbiota regarding the immune system. Then we try to come up with own ideas for therapeutic strategies. So not only what is known, but also how can we use it and could you think of to improve the current knowledge.
My area is actually to making biological medicines. So my group really works together with all these different groups around the world to make these new therapeutic drugs. And we do basically the first 3 years for drug development to make new therapeutics. So the link between inflammation and pathophysiology and my professional career is very clear. It's antibodies. Antibodies are really a major part of the immune system, are very important in the process of inflammation. And you have to understand how inflammation and pathophysiology works to develop new medicines as antibodies.
Well, the internships are so broad. They could take internships in different departments in this university. They could go to industry where there are many experts already teaching in the course which offer internship positions, from a small pharma to big pharma companies.
I mean, several students actually also applied for internships at Bayer. I think the students also give a different look sometimes. Sometimes they come with questions which I would say professional people really don't ask anymore because they're so biased and they completely out of the box thinking. And that's actually nice to see. We need young people really in the job.
What I enjoy most is that we are really on the cutting edge of research. So if we are in a discussion with our tutorial group, with the other students and our tutor, the tutor mostly is an expert in exactly that field what we are discussing about, and sometimes he or she can't even answer our questions because it's not known, because it's so current what we are learning right now. So the questions we come up with aren't researched yet, and that's something that really gives me the feel to be a part of science.
The future is for them to choose where they want to go. So they could go from becoming a university professor to be going to industry where they will have their own product that they have to develop. They could also, of course, stay at the clinic and they could be part of the diagnostics or departments of clinical analysis. There are many different possibilities.